To everyone, and a big thank you to everyone who have joined us today for this very, very important discussion on antimicrobial resistance. It's a very important time I would say, in the history of the global fight against AMR. Uh, and we have a very big opportunity as the upcoming high-level meeting on AMR is about to happen in September 26, in September at New York. I am Amit Khurana, and I work at Center for Science and Environment. Center for Science and Environment, for many of you, if you do not know, is a policy research, public interest, advocacy organization. We work on development issues, and we work on development which is essentially sustainable as well as equitable. Very quickly on the AMR program. So it all started about a decade and a half ago, our journey on AMR when we tested for antibiotic residues in honey. From there on, we have been working on the policy side of it, on the capacity building side of it, working on the animal as well as the environmental dimensions of AMR, working with state One Health ministries as well as the national level ministries in India. We've also worked in several countries in Africa and coordinate at the global level also for the global governance structure. I mean, Sunita Narayan, our head of the institution, is a member of the Global Leaders Group on AMR. And that basically is also gives us a platform to share the point of view from the LMICs for the purpose of global guidance and global policy making. Now, why this discussion? So our decade and a half experience on work on this issue clearly tells us that LMICs have different challenges. And when I say LMICs, I'm talking about low and middle income countries. So on the issue of AMR, clearly we have different challenges. I'm talking about countries in Asia, I'm talking about countries in Africa, and I'm also talking about countries from the Latin American part of the world. Our challenges, as I said, are different. Our possibilities are different. We do things differently. We will have to do things differently. This is what is very clear from our experience. Now, that doing things differently would actually mean that we got to leverage what we have. We got to maximize the resources that we have. We got to be innovative. We got to reinvent the processes and how we do things. But we have chance to leapfrog. We can be bold. We can be transformational, and we have to basically make sure that we are not left behind. Uh, and we see this high-level meeting on AMR as an opportunity. Today's discussion is essentially about a report from the workshop that we did in April 2024, when we had about 45 AMR focal points or experts or stakeholders from the LMICs. We sat together, we discussed and trashed many issues and figured out what do we really want to do, what can we do, and what do we need to inform the global audience, the larger stakeholder group, so that the global policy making or global guidance is or the political outcome of the meeting that is expected is adequately informed. Uh, Now, in that context, I have a very wonderful, I would say, a very important set of stakeholders or panelists today to discuss this with me. Let me very briefly welcome them first. So a big welcome to all of you and a big thank you for joining us. Um, I'll quickly introduce each one of you so that I do not really have to do it later on. So I have with me, first of all, Jean-Pierre Neamazi. We call him with a lot of affection, JP. And JP essentially is an acting director, global coordination and partnership, and also an acting director of the Quadripartite Joint Secretariat on AMR. JP is someone who knows, who will today tell us what is the status of the discussions at the UNGA or the preparation of the political declaration or the outcome of the HLM. So very important person we have today. So that's something we will get to know from JP. And then we will have some discussion, some interventions from experts on different issues that we have identified, very similar to the way we have done it in our report. We have Dr. Sujit Chandy. Dr. Sujit Chandy is the Executive Director, International Center for Antimicrobial Resistance Solutions, Denmark. And he comes from India, and we know him very well. And I can bet that There's hardly anyone who can explain things in the most simple and effective way than Dr. Chandy. So we look forward to hearing from Dr. Chandy today. Then we have Dr. Benedict Sim Lim Heng. Uh, Dr. Heng is infectious disease consultant, Sungai Buloh Hospital, Ministry of Health, Malaysia. A very important country, very important intervention that he's going to make today on the national action plan implementation. And he's someone who comes from the health side of the issue, the health sector side of the issue. So thank you very much, Dr. Benedict, for joining us. We have Lena Mengene. She's the IP advisor and South Asia head, Medicine Sans Frontiers Access Campaign, India. So I hope I have pronounced many of the words correctly. It was very difficult for me, Lena. So Lena actually is someone again coming from India. She's an expert in areas of access to medicines and she has worked in several areas, including AMR, HIV, and hepatitis. So she's an expert. So we are very keen to hear from her today on the issue of access. We have Dr. Yewande Alimi, One Health Unit Lead, Africa CDC, and Dr. Alimi, she's very much closely working on the with many countries in the Africa, and she's the leading lady in terms of taking the message out of Africa to the larger global community, AMR community, and the health community. So thank you very much, Dr. Alimi. We would also get to hear from Viviana Munuz. Viviana is a coordinator health, intellectual property and biodiversity program at South Center, Switzerland. We know South Center is a very important intergovernmental organization. They work very closely with many low and middle income countries of the global South. So, but we would have a video message from her today. She could not join us. So what we will do is, the way we have structured is, we quickly have a formal release of the report. And many of you, I'm sure, would have got the link of that report and are able to download it when you got the invite for the webinar. So Rajeshri, if you could just help put that on the screen, please. So this is the only way we can now do a release in the online format. So very efficient, very cost effective, and that's it. So very quickly, I can tell you a big thank you to everyone who joined this workshop from many countries and different parts of the world, and their openness to talk about several issues. So the list of experts who joined this meeting is also mentioned in this report. And this report essentially has 4 chapters or 5 chapters, if I may say. And Rajeshri will talk about this report in a very nutshell, the key takeaways. And this can be downloaded from our website. And I would request my colleagues to share the link on the chat if they can. A quick word for everyone. We have about 3 or 4 sessions today, one on NAP implementation and financing. But before that, we would have Rajeshri present and then hear from JP. Then we open up the panel discussion, interventions from different panelists. And meanwhile, if anybody has any questions, I would request them to put in the Q&A session so we can take up, or I can help the experts answer those questions and put them across to them. So with that, I start. Rajeshwari, if I may request you to quickly take us through the key takeaways.
I'll just do that. Thank you, Amit. Yeah. Is it visible?
Yes, please go ahead.
Yes. Good afternoon, everyone. Hello from India. This is Rajeshwari, and I'm making this presentation on behalf of the AMR team at CSE that put together this workshop and also worked towards this report. But before going into the key takeaways, like Amit has already mentioned, a quick word of acknowledgement and gratitude on behalf of CSE to all the experts who came to our campus, ATI campus, physically as well as joined online and made contributions. Significant contributions from different stakeholder groups across different One Health sectors, and a lot of African and Asian and LMIC representation. I also wanted to quickly highlight that we had released a report during this workshop on challenges and possibilities to prevent and contain AMR, again from the perspective of LMICs. And this was CSC position based on its body of work for over a decade and a half. And the key takeaways in this report form the basis of discussions in this workshop. So this was a report that was released. And then going forward, some of the key issues that we had picked up for discussion in the workshop, again, very much from the LMIC lens, were financing for One Health AMR action plan implementation, financing for antibiotic research and development and the access angle to it, the food systems transformation with a preventive approach towards sustainability, managing antibiotic pollution from manufacturing and the antibiotic lens, and target setting, where we also talked about having differential targets for LMICs and need for enablers and challenges. What I'll do is, quickly take you through the key takeaways that are mentioned in detail in the report. Going on to the first topic on financing for One Health AMR action plan implementation. One of the major points that came out was national AMR action plans are indeed critical for local action, but they are currently very much dependent on donor funds and even impacted by it, which needs to be optimized. And this optimization is possible through dedicated global investments, optimized support and coordination across and between donor priorities, leveraging on existing global health programs through catalytic financing, adoption of milestone-based systems on financing of key components of NAP, integrating AMR into existing funding portfolios, and also considering options of a global tax. Another important issue which stakeholders talked about is that while donor funding is a concern, which I just spoke, domestic funding also has to become an important topic to be considered. It has to be mobilized for sustainable action against AMR through dedicated budgetary support by including AMR as part of country budgetary frameworks through different approaches, involving public-private partnerships, academia, and the civil society, thinking about innovative financing mechanisms if we are to talk about domestic funding in the long term, like microinsurance mechanisms, social impact bonds, health insurance programs, and also having a well-established AMR coordination mechanism. That national action plans must be costed, prioritized, multi-sectoral, and yet integrated is also something which LMICs thought should be of concern. They have to be cost effective and aim to leverage on existing resources. A costed and prioritized action plan is important as they form the sound basis of mobilizing funds, allocating resources, and short and long-term action on the ground. Prioritization will also help in making costing of NAPs easier. At the same time, having multi-sectoral NAPs well integrated not just across sectors, but also in programs and functions is also critical. It is also clear that experts agreed that financing will be benefited by greater commitment, coordination, collaboration, and having AMR champions, while at the same time co-designing, co-development, and co-implementation of NAPs are important. National action plans and their implementation mechanisms should be made fit for purpose. Most of the issues in AMR being systems-based, addressing AMR need not follow a disease vertical approach. For example, a more people-centered lens to NAP development, which is a far more consultative and a less top-down approach, would be more relevant. And also considering NAP coordination responsibilities housed at offices higher up than line ministries, as we saw in the case of COVID, was also considered something very important. A global governance structure or a coordination mechanism that at the same time ensures multi-sectoral action can also be formed. So these were some of the points related to National Action Plan implementation. Moving on to the financing of antibiotic R&D and access in LMICs. The main point which came out was prioritization of interventions and investments in antibiotic R&D must be based on public health needs, including those of LMICs. It is clear that at the time of the workshop, that antibiotic pipeline was not sufficiently aligned with public health needs. I'm sure there has been some progress to it as of now, particularly in case of LMICs. The public health burden in LMICs being extremely small for some of those which are under development, and LMICs clearly do not have much tools to address the problem of resistance. Now, coming to access, improving access must be critical to antibiotic innovation and financing interventions. The issue of having access to antibiotic is a global concern, not just in low and middle income countries, but in northern richer countries as well, due to several reasons. And because of that, bringing a new developed antibiotic particularly to LMICs, become a challenge. There are some initiatives, but a lot more thought needs to be put into it. A lot more programs need to be designed and promoted. Talking about access, it's not just about new antibiotics. Access to the right antibiotic, old and new, still remains a big concern in LMICs and need to be addressed systematically. And for this, issues like effective procurement mechanisms, working closely with generic manufacturers, linking new antibiotic access with affordability, and supporting antibiotic access with foundational access to diagnostics, vaccines, as well as laboratory facilities are key areas that need to be considered. The group also talked about non-financial measures over and above the financing support that can help antibiotic R&D as well as access, and it became clear that regulatory harmonization is one such measure which is needed for early access. But we have to be careful that new antibiotics are introduced in a controlled manner by governments in order to avoid its overprescription. Regulatory harmonization can bring down the cost of bringing antibiotics to the market and also speed up the R&D. Financing mechanisms also have to now go beyond push and pull mechanisms and reflect a balance in public private partnership. It is clear that pharmaceutical companies are coming forward and are committing funds, but they are expected to do a lot more. It is not just about bringing pharmaceutical companies, big pharma, back to the antibiotic development space. It's also about reorienting or reprioritizing public health outcomes over and above sale and profits. It's about considering how to retain the talent and expertise in developing antibiotics. It's also about thinking from a consortium angle how designated funds can be pooled for effective projects in LMICs. An interesting area which LMICs thought is that why don't we become the solution? LMICs can become the first choice as a hub for antibiotic development. That is because the tough bugs, the high patient load, the low cost of development, as well as manufacturing, is all of it is here in the LMICs. Production-linked subsidies and incentives, these kind of support to companies with good chemistry manufacturing controls will not only help create a low-cost antibiotic development ecosystem, but it will also remove the barrier of low expected returns. Lastly, epidemiology should drive where the studies on antibiotic development take place, and systems and incentives should be accordingly aligned. Coming to the food systems transformation topic, where we were largely looking at the preventive approach to sustainability. Experts who came to the workshop and who spoke at the workshop agreed that reduction of antibiotic use is possible in intensive food production systems, very much through preventive measures and alternatives. There are examples not just in EU and the UK, but also in several low and middle income countries where approaches of biosecurity, alternative use, and better monitoring have worked to reduce the need for antibiotics. At the same time, the issue of vaccination was also talked, where it came out that it need not be seen as an only solution when it comes to prevention. It is a package, but there are concerns related to vaccination in LMICs. Preventive solutions are set to make the food system sustainable. They should be cost effective or incentivized to enable upscaling. It is clear that prevention has to be at the core of a sustainable transformation of food systems, and they should be used to in the first place, reduce the occurrence of diseases. Greater reduction in antibiotic use is possible if food animal production starts moving away from intensive approaches. And at the same time, upscaling prevention measures is critical, considering they are cost effective and their adoption is incentivized. Another major point which experts agreed is that food systems transformation has to be holistically made and sustainably made. Right now, it is at the intersection of the triple planetary crisis of AMR, biodiversity, and climate change. So, if addressed correctly, there are multiple co-benefits to it. It is the people who should come forward and drive action. It is the people and livelihood which should be at the center of the transformation process, but also being cognizant that this transformation is not going to be easy, and there are challenges of scaling up prevention measures, of reducing the cost of sustainable production, and ensuring food security concerns while transforming as well. When it comes to managing antibiotic pollution from manufacturing and the antibiotic lens, it was clear that there is a global momentum to curb antibiotic pollution from manufacturing, which is being led by the government and the industry action. This definitely needs to be strengthened and expanded. There were discussions around responsible manufacturing at the local level, the big companies having the means and resources to monitor residues and being able to support smaller companies in their supply chain. Some country-level initiatives were also discussed. For example, in India, the manufacturers are working around upgrading or modifying zero liquid discharge or CTPs to reduce the entry of antibiotics into effluents. There is also criteria for procurement of antibiotics happening in Sweden, and how Africa is working through a stepwise approach to keep the manufacturing industry stay in business. There was also discussion on the need for standards for monitoring antibiotic residue levels. And while compliance to discharge limits is needed, but it is resource intensive and has to be approached systematically to avoid the access crisis. Experts agreed that we need to be cognizant about the cost of mitigation and the compliance to such discharge limits. And implementation of standards should avoid the risks of jeopardizing access to antibiotics, particularly in low and middle income countries which have limited capacity to buy but are severely in need of these antibiotics. Preventive measures like process control measures or global subsidies and incentives can support the control of antibiotic pollution in LMICs. The last session was on target setting, where we talked about differential targets in LMICs. And it became clear that targets are needed, but they have to be differential for countries. Low and middle income countries must unite to prioritize the prevention interventions for the greatest impact on mitigating AMR. They have to be equitable, ambitious, yet practical and impactful, being that they are the cornerstone in managing AMR. And prevention is at the core and is the key to achieving most of the targets. Effective communication with policymakers around targets is also critical. So is effective messaging of the issue. The group also understood that LMICs not only need targets, but also have to identify enablers and challenges on how to achieve these targets. With this thinking, we also moved forward to identify enablers and targets for 3 of the proposed GLG targets, 2 centered around human health and 1 centered around animal health, which I'm going to just show you very quickly. I'm not going to go into the details, but this is how we worked in groups and then clubbed into themes to understand what are the key enablers and what are the challenges that would come if this target is to be achieved, particularly in LMICs. So I'll quickly go through these slides. And all this is available in the report. So I'll stop there. Thank you. Thank you.
Okay, thank you, Rajeshri. If you can, yeah, wonderful. So thank you very much. And once again, a big thank you to everyone who was there at the workshop. And some of those experts are here today to take this forward. So I would now request JP to let us know, to let everyone know what is happening at the negotiation process at that level. What are the key issues? Over to you, JP.
Thank you, Amit. And I will start by thanking you and Center for Science and Environment, of course, for hosting us back in April, but importantly for sponsoring this work and really inviting the LMICs, giving them the platform and coming up with these recommendations. So big thank you to you and Sunita and the whole team for this. I will also say that low and middle income countries bear a high burden of the effects of AMR. I think we know that from the different data points that have been published before. And also we know the reasons. We know that many LMICs have fragile health systems and inadequate investment into basic health infrastructure. Preventative measures, including WASH, IPC, waste and water treatment infrastructure, animal husbandry practices, vaccines are less accessible. So we all know that. So we know that contributes to the high rates of AMR death, and also it affects the economies in the LMICs. So now, however, we also know that, and I said it previously, that when you go into the forum where the AMR is being discussed, you rarely see LMICs being vocal and coming to the table and discuss the solutions of this big threat to themselves. And I think this type of webinar and also this type of report tries to change the dynamics. And we're glad to see that LMICs are now stepping up and really they're trying to address the AMR, and they are taking even the lead in terms of developing the right strategy, even financing their national action plans. But it's still low in many cases. Now, speaking about where I work from, I'm part of the quadripartite organization, as Amit introduced me, and there we support as well the work of the Global Leaders Group on AMR. And I will say that they have produced the reports before this one, and they provided a number of recommendations to the member states for their consideration when discussing the high-level meeting political declaration. And I'm pleased to see that the recommendation coming from this report, talking about AMICs, really aligned with what the GLG and the quadripartite organization had put forward. I'll just make a quick summary of what the recommendation have been put forward from the GLG and the quadripartite organization. The first one was about implementing measures for effective subnational, national, regional, and global governance leadership and coordination. So we still see that this is going to be critical, establishing the governance required across all the levels. Multi-sectoral coordination is going to still be key going forward. The second one is financing. So we need to ensure that AMR activities or interventions are adequately financed. And we also made it clear that we don't want as well AMR to be a vertical program, another vertical program, because we know it's costly for LMICs to manage it as another vertical program. We'll rather say that AMR can be integrated as much as possible, being in the health systems for human health related, being in agri-food systems, being in environment action plans. We need to recognize the AMR and try to devise the strategies to address that. Number 3, as a recommendation, was to commit to actionable targets and bolster monitoring and strategic information systems to guide and accelerate AMR. So we know we need the data, and we need to also be accountable. I mean, we all know they say that, you know, what gets measured gets done. I think that's why the Global Leaders Group, the quadripartite organization, and also in the report we just saw, that people are pushing for this political declaration to come up with some targets or with some measurable commitments, because that will help us to monitor and also, of course, to follow up on the delivery of the commitments that we make. The other equally important recommendation was about preventing the emergence and spread of AMR through system-wide transformation. And this clearly aligns with what Rajesh spoke about, you know, transforming the food system, you know, to make it more a sustainable food production system. It's one of the key strategies. So we need to build our prevention strategies, you know, across all the sectors. And we need to less and less utilize the antimicrobials by just avoiding to have the need. It's not brand reduction of use of antimicrobials, because you still need them. There will still be diseases and you need to still treat and prevent. But we can probably invest more into prevention, then we'll have less need of using the antimicrobials. So the last one, as a recommendation, but not the least, is to tackle the research and development barriers that prevent the equitable access to new and existing antimicrobials, diagnostics, and other tools that help to prevent and address AMR. So these are the main elements that the GLG and the quadripartite did push forward. And I'm glad to see that the MIT's report as well to align almost entirely to this. I will also say that we were glad to see those recommendations taken forward in the zero draft political declaration that was released back in May 16. And I think many people have seen that. It's available on the President of General Assembly website, and you can see that. So most of these recommendations were raised and were included there. Now, the current state, as we know, this is a member states negotiation process. So it's really a political process. The technical elements or the technical support have been already taken place through these reports that have been released. And now it's in the hands of the member states negotiators, diplomats in New York, representing our own countries and representing our own regional and economic blocs. So we need to know that. Where are we at this stage? The second element I wanted to raise is that the high-level meeting is happening on 26th of September. There will be a whole day dedicated on AMR. It's a big thing, as Amit said in the introduction. However, what is going to be discussed on that day? The decision will have been made earlier on. I mean, the plan is that by 2nd of August, the political declaration should be done and put on silence procedure. I'm pretty sure probably it will have still some few instances that will be required to be changing, maybe even take the whole month of August. But so far for the timeline we have, by 2nd of August, this political declaration should be over and agreed by the member states. So then time is for now, if we want to continue to advocate for it to come in the shape that we want, this is the time that we can continue to advocate for it. Now, what are the current issues and what is coming out from the negotiation? First, we need to understand what did we want, because we had the first ever high-level meeting on AMR back in 2016. We all know that political declaration of 2016 did include about 8 commitments. We did a quick evaluation to see how far we are with those commitments. We could find that only 2 out of 8 were really completely achieved. And we tried to analyze why a few of those commitments were implemented. And we came up to a conclusion that if you write a political declaration which is not specific, so basically you're very broad in your commitments. If you come up with a political declaration where the commitments do not have assigned responsible institution or country or individuals to follow through and implement, that commitment is less likely to be implemented. Number 3, if you come up with a political declaration which is not time-bound, not measurable, I mean, again, it will be there, it will be a nice wording, but rarely you'll see something tangible coming out of that. So we started with that knowledge that we have to push for this upcoming political declaration to be specific, action-oriented, measurable where possible, and make sure that each commitment you can see who is supposed to follow this through. Those could be the member states, those could be the usual UN institutions, WHO, FAO, UNGA, UNEP, and the others. Those could be the World Bank. Those could be, different individuals and different groups, including the private sector, to take forward the actions. Now, what do we see? Because now we are almost, I think, a month and a half, with the negotiation going on. So we are a bit worried that we might again fall in the same issues, where you might again come back to the same political statements, maybe less ambitious or vague or not easy to follow through. So there are also some issues relating to the geopolitics that we see, where you can see that, a few things or a few actions are really good for everybody, but you see some countries or you see some people, some groups that oppose just because of the geopolitics. I mean, there are a few other things that probably are very relevant to the MIC, such as increasing access, improving surveillance and data generation and use. All of these are very critical. So we need to be aware that these are the elements as well that are very critical to the MICs. Then we need to support them, not opposing them because of any geopolitical differences. So I'll mention a few other things like the independent panel, which has been advocated for by the GLG, by the Quadripartite Organization, and actually that came from the previous political declaration of 2016. It's a nice thing to have. It's going to be informing the member states and the UN agencies and everyone else in this area about the key actions and the progress that we are making around AMR. But we see some opposition, not necessarily being informed by by the scope of this body. And we understand the first thing that we need to push for is always that these bodies are, of course, set up or established in consultation with the member states. So there is no question about that. Targets are being pushed back, but we know that, yes, we don't want to push targets to the individuals. And I think Rajesh explained it clearly. They have to be context specific, but we need to have some global goals and aspirations that are going to guide us for the next decade or so. So we need, I think, to be clear that a few things being pushed out, maybe they are very useful as well for the LMICs, that we need now to suppress any geopolitical or any difference that we may have, and then try to really look at this as a unique opportunity that we have as AMR community to push this forward. I think we need to do that, and we need to push our leaders at a high level, and we have the authority to doing that as a citizen of the world. I think we need to work through the member states negotiators to try to raise this urgency of really committing this at this right time to really very bold and specific and measurable, if we can, actions to address AMR. Of course, covering all these areas that I spoke about: governance, financing, access, research and development. We need really to be watching the process and voicing out what we need to see to come with that. Again, I want to thank you, Amit, and the colleagues for inviting us, and all this still here around. And I know also we have some other colleagues, even from the GLG, who will probably come in if you'd like to get more ideas from the group. But again, thank you so much, and we really stand by to work with the LMICs and move forward with this agenda. So we are still being involved in the process, and we can always still update you and brief you, but also take on board your suggestions so that we can relay them to the negotiators at any time we get the opportunity.
Thank you very much, JP. Very, very useful points from you. I mean, very clearly articulated. I think everyone would be benefited today in terms of where we are, where do we stand, and what do we now need to do, where are the gaps. But for me, I can see the sense of urgency and concern to a certain extent. I can clearly hear from JP that the time is now. I can hear from him that, yes, LMICs are working, they are stepping up, but they need to do more, get together, be more vocal, take their message forward. And I clearly feel that what JP is saying to all of us is that it's important that we advocate for actionable, bold, very ambitious, measurable targets or actions, because that is what was not there in the earlier declaration, and therefore we could not move on the AMR the way we should have moved. So thank you very much, JP. I might as well come back to you, JP, again towards the end of this when we wrap this up, to know from you what you after you having hearing everyone, how do you see what are in 2 or 3 broad points is the way ahead for all of us and for everyone in the countries to interact and engage with the local stakeholders and perhaps with the global stakeholders. Thank you very much once again. I have a couple of questions, but right now I believe my colleagues are also answering them. Those are the technical ones. We are focusing this discussion for everyone to know on the UNGA related aspects, and the HLM related aspects, and the priorities of the LMICs. I do have a comment from Margie. She's mentioning that she's about to leave after JP. I mean, Margie, I'm not sure if we can hear you, but if you have any question for us or you want to comment, kindly write in the Q&A section. As a group, we will of course be benefited by that. So and yes, there are quite a lot of colleagues from many countries in Africa and Asia. This is very encouraging, and we hope that the discussion that has happened so far and the remaining part of it will be helpful to you. So just for everyone to know, we are breaking this discussion in, let's say, 3 broad sessions. National Action Plan financing and implementation, because that is what we think is a key challenge for the LMICs. The second is prevention and access. We know that LMICs would not be able to afford AMR, and prevention is our best bet. And access is a key issue. So we have clubbed prevention and access as the second aspect. And the third, of course, is targets, because that is a very important thing. that all of us now need to move forward. So we will discuss for about 15-20 minutes each of these with the panelists, along with having few interventions from specific panelists. So with that, I would like to request Dr. Sujit to actually talk about, share his thoughts on the NAP implementation and financing part of the discussion. So over to you, Sujit.
Thank you very much. And I think it's important to bring these LMIC voices to the table of the UNGA HLM. And I think, therefore, it's a very important initiative by CSC. So my thanks to the organizers, not just for this webinar, but for also the report. And thanks to JP for the very important critical points that he mentioned with the progress towards that. I think to answer your question, the key factors, in my opinion, for country-level implementation of NAPs are, one, political will and commitment. Number two, reframing the narrative, both to target the political groups, but also the public. And third is to advocate and provide for sustainable financing. So in the next few minutes, let me touch upon some of these essential points for NAPs to be implemented, especially in the LMICs. And I'd like to break this into three levels. First is at the level of the global factors. To me, AMR is a developmental issue, and therefore synergy with Sustainable Development Goals, universal health coverage, climate, for example, is essential. But at the same time, we need an economic case. Unfortunately, the world revolves around money. We need money. Countries need money. People need money. So that economic case needs to be at the global, the country, the sector, and the community level. The third point I would like to make in this global factors is it is difficult to get extra funding streams or funding pots. So therefore, we need to try and see whether we can realign with existing funding streams, for example, the World Bank, just to name a few. But at the same time, public-private partnerships, which is mentioned in your report, is another way. And we need to look at both simultaneously. And after looking at that, I think creating developmental partnerships between donors, governments, and other AMR stakeholders would be very important. Now, as we do this, I think we still need to assess the gaps in science and evidence needed, especially in LMICs. And for that, I think the independent panel would be a key way of doing things, but not the only way, of course. But once we map the evidence needed and the AMR funding landscape, that both synergizing together would help to inform investment, in my opinion. And lastly, as far as the global factor is concerned, catalytic funding to me would be key. We can't provide everything. Each partner has to do its part. But catalytic funding with incentives for progress is the thing that I like to say, that because accountability is finally very important. The second level is the country and sector and the factors associated with that. To me, the narrative should include an understanding of AMR, the consequences, and the cost of inaction. And that will be very important for political messaging and commitment. But really, to move things forward on the ground, I think, as both of you said, governance is important. And so also the coordinating and support mechanisms within sectors and ministries. And for that, I think a focal point or office is what has been always advocated, but very few countries have it, or some countries have it. But when you have a focal point or an office, it needs substantial and appropriate leverage and level and access to the key ministries. I think domestic resource prioritization came out very clearly in your report, but I'd like those domestic prioritization to focus on three levels or three key areas. One is preventive strategies like WASH, hygiene, etc., IPC, but also strengthening countries' existing programs. Whether we like it or not, AMR is really about sustainability, systems, as well as even planetary health. So that's very important in the One Health sectors. And thirdly, dedicated funding, but aligning with health and food security would be key, in my opinion, especially in today's geopolitical context. The other point in this is about R&D on cost-effective diagnostics and antibiotics. I know there's a separate session in this particular webinar, so I won't go into it too much. But I think countries have different capacities, needs, and problems, and we need to recognize that. Therefore, sector-specific risk versus benefit analysis, in my opinion, would be essential for evidence generation. And implementation studies and socioeconomic analysis for that needs to go hand in hand. The last level I'd like to comment on is the community and individual factors. And that's where we need to listen to countries, but countries need to listen and understand their own stakeholders and communities. And I think this will be helpful for NAPs to be fit for purpose. And again, for this, the framing of the AMR narrative is key, but with people, lives, and livelihoods at the center. But for policy implementation and financing, I think community engagement and local evidence is key. And that's why we need to look at implementation challenges, context-specific solutions that can create sustainable impact. So in conclusion, to me, science, political commitment, narrative, financing, the 4 key points if we need to move forward with NAPs. But to make this truly implementable, I'd like to say again, a top-down, bottom-up approach with understanding, planning, and on-the-ground evidence generation would be key to address these context-specific challenges and then develop solutions which are sustainable, especially in LMICs. As an AMR community, all of us listening on to this webinar, I call ourselves an AMR community, even a family. I think we need to work towards that as we listen to this webinar, I read this report, but especially as we move to this key time, the UNGA HLM, but most importantly, beyond that. Thank you very much.
Thank you very much, Dr. Chandy. As I mentioned and very well expected, very clear, very clean communication from your side, key messages, very well connected, drawn out. So thank you very much. I particularly like the last 4 words: science, policy, finance, and narrative. I think that sums it all in many ways. And thank you for adding to all the aspects that we have touched on the report. I'm sure what you said today will of course inform everyone who is attending today and perhaps take this forward. So with that, I'll come back to you, Dr. Chandy, as part of the open discussion in this part of this in this section of the discussion. So I'll quickly move to Dr. Benedict now. Now, Dr. Benedict comes from the health side of the problem, if I may say. And he's from Malaysia. He very well works. He's part of the national implementation committees and programs. So let's hear from him. Dr. Benedict, over to you.
Thank you, Amit. Yep. So I'm a clinician. I work in a hospital. I'm an infectious disease physician by training. So AMR is really the bread and butter of what I do every day in terms of treatment. And I also been privileged to be part of the in Malaysia part of the preparation of the last 2 national action plans that Malaysia have had. So firstly, I'd like to congratulate CSE on this comprehensive, thorough, and yet very succinct report that has, I think, really put the spotlight on the AMR battle, within our LMIC region. And I think it has also hit the nail on its head on many of the challenges that our individual countries face. The AMR, the NAP, the National Action Plan, I think it's supposed to be the roadmap for how each of us countries within our borders tackle AMR. And while in Malaysia we are now in our second national action plan, and the words and all are very nicely written. But I think for the national action plan to work, at least in my country, and I believe in many other countries as well, it needs to be adopted and championed by wide-ranging sectors in the country. It's because it needs to be felt much further than, in the hospitals or in the critical care units where I work in, but it also needs to be felt in primary health, in public health, in retail pharmacies, agricultural sectors, even domestic pets, and then food production, not forgetting water and waste management. So the National Action Plan needs to galvanize people across all these sectors. And so for this to succeed, I think it will require a lot of noise from the grassroots to sort of like demand to have a critical mass of noise that once in the hospitals, better therapeutics, better diagnostics, especially in public hospitals, and public hospitals that are adequately funded and staffed and being able to practice appropriate infection control and not being overcrowded, to have strong research infrastructures that can study and understand the AMR problem better, especially within our own countries. For example, like I think our country in Malaysia, just before COVID, we collaborated with WHO and the tripartite, and we came up with that report that actually showed that AMR was prevalent even in river waters and in the cecum of chickens, and in healthy adults who had never been to hospitals and never taken antibiotics, and so that sort of like was a very strong message that local research managed to highlight, and even until now, that messaging I think is making waves locally, and then also to dive deeper into the weak links on where AMR emerges and where AMR spreads, and to produce better, safer, more accessible diagnostics and therapeutics, not just for human health, but also for animal health, and enough noise to so that there's we can institutionalize safeguards against over-prescribing or inappropriate prescribing of antimicrobials, whether it's at public hospitals or very importantly at that private healthcare settings, whether it's private hospitals or private primary care healthcare settings where there is sometimes financial incentive for antibiotics to be overprescribed as well. Yeah, and also and the same thing goes in agricultural and veterinary settings. So as mentioned very clearly by Dr. Chandy and by the rest, I think political buy-in will actually be key. And this is why I think a document like this that CSC has come up with, it really needs to be read widely and by the political leaders, whether it's at the UNGA meeting or locally among our politicians. Recently in Malaysia, we had the opportunity to present the AMR case to select parliamentarians across the political divide, and we hope that this will be a seed for more in-depth conversations with them and dialogue across the country, and hopefully if the politicians start talking about it, the issue will gain more traction among the public. The report said it very clearly. I think and all that the previous speakers as well mentioned, while the NEPs look nice on paper, but when it comes to funding mechanisms, I know for my own country, there was no mention at all about how much each of these plans will cost, and what is the funding mechanism that we are targeting for this. And so and the funding largely depends on existing governmental funds, which everybody wants to get at. So we have not seemed to have explored enough innovative partnerships with private companies, whether it's health-related companies like health insurance companies, or food producing companies, multinational companies that are involved in the fast food agency, for example. I remember big multinational companies like Burger King and in the US saying that they will go from now on, they will go towards some antibiotic-free meat. I was thinking if McDonald's were to say something like this, or Kentucky were to say something like this in Malaysia, straight away you get people, the populace talking up, why suddenly are they talking about antibiotic-free meat? Is it something that's really important? Is it something that that we should be striving for? Yeah. And
Benedict,
also,
I'll have to request you to conclude.
Sure.
I'll have to request you to conclude, please.
Sure. And when it comes to funding, also, I think we can also learn from our colleagues in the fields of for HIV advocacy, where there are separate body that looks into opportunities for funding and tie in with corporate bodies and civil societies. I think there's also that it's also been mentioned by Dr. Chandy about accessibility to medications and funding for new antibiotics, and also I won't be going further into that. Thank you very much.
Wonderful. Thank you very much, Dr. Benedict. Well, very hard to do justice to such an important issue in such a short time, but we are running short of time, but I would still kind of take some be ambitious here and hope that we have some points, additional points from, if I may call upon Dr. Wande Alimi, if you would like to very briefly in 2 minutes share your perspective. You think there's something that you would like to add to this discussion?
No, thank you very much. Really excellent discussions by the speakers. I think more than ever, we are saying the same thing, and is that the perspective of LMICs need to be reflected in the global resolution, as well as the subsequent sort of sustainable financing that would come out of these discussions. I think, yes, indeed, the UN General Assembly eye-level meeting on AMR is important, but there are subsequent sort of actions or meetings, like the global ministerial meeting that's going to be happening in Saudi Arabia. So more than ever, like my colleague JP has said, is that it's really country-driven. As technical people, what are the advocacy steps that we need to take just before the next reading? I think our messaging is clear. Some of the elements that we have raised, such as preventive approaches, equitable access, are already being reflected. But for a population across Africa, Southeast Asia, Latin America, that really faces the high burden of AMR, what are the clear actions that this high-level meeting can help us achieve? What are the clear actions that our countries, our populations can benefit from these declarations and from these targets? So I think more than ever, it's a call to action for everyone on this call is, what can we do? What steps can we take to ensure that our country representatives see the importance of AMR, be our voice in that closed room, so that our perspective and our needs, our priorities can really be highlighted in this declaration and the subsequent actions that follow. Back to you.
Yeah, wonderful. Thank you very much. I think I will have to move to the next part of the discussion right now, immediately, and that is about prevention and access. So, my friend Lena, would you like to jump in?
Yeah, I was listening with great interest, and I must say that in preparation for this webinar, I went through several documentations. So I would just like to highlight the state of play on the UNHLM. Most importantly, the first draft came out on the 6th June, zero draft, and we had a second one around the 28th of June. There are another set of negotiations tomorrow, and we're likely to see another draft in the public domain for comments, I assume. by member states, to member states as we speak. So, these are very important discussions hosted by colleagues from CSC and others in civil society and government. So really welcome over here. And I just wanted to highlight a few things that I speak from the report, which is very simply put and useful, that CSC's shared, and actually very well incorporated some of the inputs that civil society has provided to CSC as well as experts. So one of the first things I wanted to highlight, that it's really critical that access issues are also included in the political declaration. The reason why I'm saying is this, that we've already seen a lot of attention as a result of the Lancet series on prevention, for example, on WASH and IPC. But at the same time, we also need an equal amount, if not more, attention on the access issues that actually affect people directly in terms of diagnostics access and treatment access. So two things that are very important going forward in terms of the political declaration. The second thing I wanted to say is that what MSF is choosing to do is back very concrete access initiatives. For example, the HIV program a couple of years ago struggled to buy penicillin. There are treatment providers who've told us that they can't get the pediatric formulation of cotrimoxazole on a daily basis, whether it is the struggle of DRTB patients to get access to pediatric formulations of Delamanid or bedaquiline, to the role of programs like HIV, who have to procure penicillin for the prevention of syphilis in pregnant women. We are seeing that there are access problems, and therefore one way of addressing it is to look at pooled procurement mechanism that will plug the holes in the procurement of older antibiotics as well as the newer antibiotics. Not only pooling volumes, perhaps also offering a level of quality assurance to treatment providers like Medicines Sans Frontières and others in resource-poor settings, which are like ministries of health. So definitely we need to back these initiatives, which are now at the very moment of genesis, as I would say, as the Global Drug Facility was about 2 decades ago. The issue also that really begs our attention is also, how do you monitor the gaps? When you go to a primary healthcare center in a remote part of Northeast India, what diagnostics do you really have when you have an outbreak of typhoid, dengue, and scrub typhus at the same time? Are we offering the tools to people to incorporate in the different referral systems like primary healthcare, to secondary, to tertiary? Do we have the capacity, the lab capacity to back the use of the right antibiotics for our patients? And I think this is something, monitoring of gaps, whether the antibiotics are placed at the right level of healthcare, they are available when they are really needed, they are backed by the diagnostics that we really need. In the middle of a fever outbreak, for example, in a resource-poor setting near the Myanmar-India border, for example. And these are the kind of the gaps that we need to come up with tools to start monitoring. And we haven't been able to do it. And I think we need to really start thinking about those. The last point I wanted to make about access, and one of them, of course, is the fact that market-driven models of R&D don't work. You can't link it to volumes, and you can't link it to high prices. So yes, more initiatives and funding from governments for R&D that are not linked to high prices or volumes are very important, and therefore, initiatives like GADP are, of course, very important in this landscape. But having said that, one of the key drivers of the successes we've had on HIV and TB has been the leadership provided by the HIV and TB community to policy making. And one of the key things that I noticed, for example, despite the fact that you see a large number of people with advanced HIV die of severe bacterial infections, you don't see communities who are directly affected by antibiotic resistance on the table. And I think this is really a big challenge. I come from the sexuality movement of the LGBT community. And when we struggle accessing antibiotics for STI, we are not seen as stakeholders in the larger discussions on antibiotic resistance. So I think if we are to drive the access agenda forward, we definitely need to talk to vulnerable communities who have a huge stake and work with them on treatment literacy, put them on the table at, policy making initiatives such as this, all of them being very important. Lastly, I wanted to make a larger point about India. For a long time, the health movement has highlighted that we need more funding for the health ministry's programs. And this is really very key because we can't pull resources from existing resources. We can't start pulling out resources for interventions like WASH, IPC, stewardship out from the existing health budget. So if we are to look at financing, we shouldn't just look at the global financing mechanisms, but increasingly middle-income countries are being asked to fund themselves. And if they are being asked to fund themselves, we need to start looking at how the health budgets are shaping, how much are countries, paying attention to health budgets, and also seeing what proportion of that health budget goes towards fighting antibiotic resistance. And I think these are some of the key issues that I wanted to put on the table in terms of access. And I know that Rajeshwari is waiting to discuss prevention, so handing it over to you.
Thank you very much, Lina. I think we are solely agreeing to the fact that access is one of the most critical aspects that needs to be addressed, particularly with reference to LMICs, both access to new antibiotics as well as old antibiotics. We also, in a way, have understood now that, and I'm sure, and a lot of that has happened through you, that this access, in a way, can also prevent the spread of resistant bacteria. So access and prevention have a very strong connection. We also know, I'm sure most of us would know, that more people suffer or die because of lack of antibiotics than because of drug-resistant infection. And I hear you well. I'm sure many of our participants, our audience has heard you well. If I can quickly bring in JP here with a request to let us know how access has been part of the current, because Lina has a concern here, JP, and we know that concern from her based on our one-to-one discussions, that how can we now help make sure that access gets due weightage in the declaration, and what is the current status right now?
And to add to that, Jean-Pierre, is that I see a lot of efforts towards collection of data and surveillance, but we see very little funding for actual interventions for communities, And unless you have interventions for community being designed and delivered, we are not going to be able to do much with the data. So we're collecting the data so we can shape a public health response, but we don't have the interventions, community-based interventions, and interventions across the health system. So where's that going to fit into your UNHLM discussions with member states? Yeah.
Thanks. It's a big question, and I hope other panelists can also weigh in as well. But it's also critical, and we knew that access is going to be a sensitive element for the LMICs, and for the right reasons. At least I would say that the big improvement I saw was that access was not only taken as access to antibiotics or access to treatment options. It's also about access to other solutions of the response to AMR, including what Lina was talking about, interventions in the community, access to safe water, access to hygiene facilities, access to all of that, right? Access to diagnostics. Before, when we spoke about access, really people did zero everything out, access to antimicrobials. I think that at least has been broadened up. Now, the question is, if you want money for access for just AMR, it's a complicated process. I think we've come to see that it's unlikely that this process is going to yield to a new financing mechanism. I don't think so. Rather, it can open up for the existing financing facilities to embrace AMR, which to me is the right thing to do. If we want to be sustained, we need just to approach our own government and try to get domestic funding to really include AMR-specific actions, not try to make our AMR as a standalone stellar type of program, rather show that AMR can provide value add to addressing HIV and AIDS, can provide value add to addressing malaria, can provide a value add to the sustainable food production systems. So we need, I think, to be very smart into that. Then we can access the access facilities, financing mechanisms that are there. Now, let me try to be very specific. I think we started this process trying to push for the existing financing mechanisms such as the Global Fund, the World Bank, the Green Facility. You all know the existing and new coming financing facilities. They are still there in the declaration, if you've seen. But already some started to get feeling from these existing facilities to say, if you want us to do AMR, we need more money to replenish our budget so that we can solve for AMR as well. So it's not going to be an easy set, but I think there will be something that will come through the existing facilities, the multilateral development banks. We need really to get those facilities that are existing to embrace the access, and we need to speak about access, not only access to medical or drugs. Now, we also need probably to do much of work in terms of, and again, I think LMICs can be really good into doing this. I think LMICs have shown previously in diseases like HIV and AIDS, malaria and the others, to come up with some low-cost solutions, like using the community health workers that Lina was alluding to. They have been really great in terms of reducing the child death and maternal death in many places. They are really the low-cost type of interventions that we need also to embrace for AMR. We also know that the awareness for AMR is still very low in communities, but also in even more educated individuals, in the policymakers and so forth. I think we need to keep pushing on raising the awareness. And something we've started to do at the quadripartite organization is to give the platform to the survivors of AMR, which has worked with other areas of, I would say, health areas. So we have now constituted what we call the Survivors Task Force. It's constituted by people who have faced these drug resistance diseases and who have successfully, luckily go through them. And they have been really very vocal into speaking and giving the AMR a human face. And they have really emphasized on the need to access for these solutions. Because if you see many people dying in LMICs, they're not dying really because of AMR. They're probably dying because of lack of access, right? Because, it's pretty tough to say that someone has died of drug-resistant pathogens if you didn't try and did the blood culture and try to identify which drug, try to find the right drug and address that. So there are still issues around access to existing antimicrobials, but we need to address all of that as well. But we need as well to still embrace and support the efforts to discover new solutions. Again, LMICs, we should not close our eyes when we start to talk about the new solution, the new antimicrobials to be developed and discovered. So all of this in a way or the other, they are being addressed in the political declaration. And if I may ask, is that we look into that with the LMIC's lenses and try to say, can this be specific? Can this be more addressing the needs that we see in the right and understandable and action-oriented terms? Otherwise, there will be broad statements like ensure access. What do you mean? So it should be really very specific. To who? Should it be directed to the countries? Should it be directed to the available financing facilities? Should it be directed? So we need to probably see how the access is being addressed. It's addressed, but how? And how can we make it more visible and more action-oriented? I think that's the task ahead of us. And then how can we make access beyond just access to antibiotics and become access to solutions to address AMR at all levels, including the community?
Wonderful. Thank you, JP. I hope that has informed and helped many of us. So I have requested, in the interest of time, Rajeshri, to not really enter into the prevention part, and I will briefly take 2 minutes to summarize. So prevention is better than cure is what we heard many years ago. All of us would have heard this since our childhood. A lot of this in prevention is about infection prevention control in the human health sector, but in the food systems, it is often termed as biosecurity. When we were working on this a couple of years ago, it was very clear to us that the global narrative, the entire narrative has to change, and to an extent that it should be centered around prevention. And we talked about this very vocally many years ago. And we have been doing that. And thankfully, there's a lot of progress on that. Now, what is important here is to know what is prevention. Prevention in the food systems is about reducing the chance or reducing the occurrence of the disease at its first place. And how can that happen? By better infection prevention and control, by better biosecurity. Now that by better animal husbandry and animal welfare practices, that's one part of it. But then, of course, the other part to that is what is prevention in the environmental space? Clearly, it's about let's say in the pharmaceutical manufacturing, it's about having better process control measures and so that at its first place there's less antibiotic moiety in the waste, so that you don't really have to spend too much to clean up the waste. What we also know from prevention is that it is cost effective in most cases. The returns on investments are much higher. It is very intuitive to many countries in the LMIC. So we really feel prevention has to be the basis of a lot of interventions. And that's why we actually say prevention has to be the agenda for the LMICs, and sustainable food system transformation, if that is what we want to achieve, can actually happen only through prevention. And that's where I would like to stop right now. Perhaps I would request my colleagues to do one more round, one more webinar only on the prevention aspects, so that we can discuss these issues at length. I will quickly now move forward to the next session, which is on targets, next part of the discussion, and request Yewande Alimi to actually share her perspective, and then we'll take it forward from there. Yes, over to you, Yewande.
Thank you very much, and really insightful discussions. I think there's been a build-up over the past few months from the low and middle income countries across the world. We really applaud this effort, but allow me to maybe bring some perspective from the African continent in terms of positioning and really advocating for some clear targets. I think I'll ride on to the last statement that has come from colleagues to say, what exactly do we mean by improved access? I think this is the part where we need to start to have clear conversations on targets. So as the African Union, we speak on behalf of the 55 member states, but nonetheless, one of the approaches that we have done is go through a bit of a consultative process to work with our member states as well as our researchers to define what targets should look like for a continent of 1.2 billion people that is most at risk or facing the greatest challenge of antimicrobial resistance. And I think our message is very aligned to a lot of conversations that you have highlighted in terms of how do we ensure that preventive approaches, which is a no-brainer, is a cost-effective approach for a lot of low and middle income settings, how can this be top on the agenda? One relevant thing for us is equitable access. Now, we recognize that access is important, but it's a simple conversation of equitable access. What happens to the children in the most remote part of Africa that don't get access to the essential antibiotics they need for that particular infection at that particular time? A lot of conversations following the Muscat Manifesto was around having a certain percentage, I think 60%, consumption of access antibiotics. But on the African continent, there's a need for some of the watch and reserve antibiotics, and we don't just have access to these existing antibiotics. So in terms of some of these conversations, this is what the African Union is doing. One of the things we're doing, and just to add on to the conversations around really having that political push, is also acknowledging that some efforts have been done over the past 2 years. I think in 2020 was when we began the effort of getting our heads of state to make a political declaration on AMR. I think for this has really given us a leverage to push this key messaging, the key targets that we are proposing at the UN General Assembly come September. This has really given the African Union member states the leverage. I think one additional thing to really include in the discussions is a lot of what we are saying today is really one last push. There's only one last reading, as my colleague JP has really highlighted. So we're really running against time. So one of the things we are doing as the African Union is we have reached out to all of our 55 health ministers with the clear messaging and some emphasis on what really needs to be presented. For example, we're talking about global financing mechanisms, but we recognize that different settings, different regions, different continents require some certain amount of investment. For example, I think from the work that the Global Leaders Group has done, it's about, I think if I remember correctly, $12 billion required to be able to avert a certain number of deaths across the world. But in Africa, it's about $2 to $6 billion required to avert, I think, about 200,000 deaths attributable to AMR. And what should this investment look at? The work that has been done by this group really highlights the value of IPC and WASH, as well as vaccines in the whole system strengthening approach. I think more often we chase AMR as a specific approach, but we really need to have a broader picture thinking. How can we ensure that this sustainable investment can improve health systems? I think if you're able to achieve universal health coverage, for example, or even improve health system, naturally you can improve IPC and WASH. You can improve biosafety and biosecurity in the agriculture sector. You can also improve access and uptake of vaccination to reduce infections. So at the level of the African Union, of course, we keep engaging with our ambassadors in New York. We are also taking an approach whereby the other groups we're sitting in, I think many of the countries represented here are either in the G77 or in the G20 countries. How can we use those mechanisms, those voices, to be able to advocate for the needs of low and middle income settings? So I think just really to tie it down in terms of the work we are doing, I think more than ever, we all need to come together as low and middle income countries, be it from Latin America, as Asia, Africa. Our settings are similar. Our needs are similar. How can we make sure that this is not a missed opportunity for the populations that really face the highest burden of AMR? So back to you, Ahmed, thank you so much for letting me join you.
Yeah, thank you very much, Yewande. I think very clear, very sharp intervention. For all of us, it's just to again let you know, we're talking about targets. There are targets which were proposed by GLG, vis-a-vis the human health sector, vis-a-vis the animal health sector, and in the agri-food systems, essentially around the access, around the antibiotic use, around the reductions. These targets they're also been targets set by many, proposed by many other groups. And there are a lot of discussions happening around those. Whether these should be voluntary, whether these should be mandatory, what should be the number. A lot of negotiations are happening around those. But one thing that we have been very clear, and that also comes very clearly, is that countries should be able to set their own targets. These should be differential. They should be able to figure out what best they can do. And of course, the individual country level targets are drawn from the larger global target, if we may say. So that's about targets. We do have we have a message from Viviana, but before that, I would quickly like to have Sujit for 2 minutes. Sujit, if you can come in, because I know you have also developed a lot of perspective on the targets. What is the larger thinking around targets? What do you think? What should be the way ahead?
Thank you. To me, there's a need for goals where all of us need to converge on that. And that is, some of the aspects of One Health, and how we should be able to improve sustainable access to effective antibiotics, whether it is in the different sectors. And also, and of course, third is to reduce some of the mortality and some of the health issues related to lack of access, for example, and AMR. So that's the goals. But the targets itself, to me, it is very important that whatever targets we set, the countries should be accountable. And they should have the resource capacity not just to do what is asked from the target's point of view, but also to be able to monitor it. That then only we know whether certain interventions will be successful, whether people are progressing, whether countries are progressing. So to me, those are two essential aspects. But we also need to remember that each sector and each context is different. And that is why what you suggested about, they're able to put their own targets is very important, because we might call ourselves experts or AMR community, but people on the ground really have a different way of looking at things and understand what is on the ground. And that is why implementation research becomes so important, even when we set the targets. So when we set the targets, let's make sure that they're accountable, that they're set by the stakeholders themselves so that they have ownership and buy-in and a kind of incentive, or we set the targets, let us try and achieve it. And thirdly, let's make sure that there is an element of incentivization so that when the targets are put and people achieve or move towards that, then there is an incentive further to go beyond that. To me, those are the three important things at this point in time. Thank you.
Thank you. Thank you very much. Lena, 30 seconds.
Yeah, so one of the targets that GATP has asked member states to include is, by 2030, 100% of a country's public health system have access to quality assured diagnostics and medicines and antibiotics. And in that context, asking for the updating of EMLs, procurement systems, EDLs, and so on. And I think that's a really useful target, both in terms of, addressing AMR, but also improving access. So I think that's one a significant target that I would back, as someone who's worked with communities affected by antibiotic resistance. Yeah.
Okay. Thank you, Lena. Rajeshri, can we quickly play the video message from Viviana, and perhaps also request everyone to stay around for another 5 minutes. That's about it. We'll overshoot by 5 minutes at max.
Hello, I'm Viviana Munoz. I'm the coordinator of the health program at the South Center, the intergovernmental think tank of developing countries based in Geneva. We have 55 developing country members across Asia, Latin America, and Africa. Now, antimicrobial resistance has been a key issue, key priority for us for over 10 years, recognizing that it's not just a global health challenge, it is a development challenge. So why is antimicrobial resistance such a pressing issue now? Well, for developing countries, it increases the range of difficult challenges already. In the health area, for example, already developing countries have a significant burden of infectious diseases. Antimicrobial resistance will make it even more difficult to address existing bacterial infections if there is insufficient access to the necessary antibiotics, as well as increasing resistance will make it much more difficult also to address drug-resistant infections. Now, what are some of the drivers of AMR in developing countries? Well, we can include among these some of the general development challenges, which include poverty, which include the difficulty of reaching all people, many that are still in difficult areas of the countries to address, where health systems might not be able to provide the services and the diagnostics, the vaccines, and the antibiotics that are necessary, or the health workers might not have the sufficient training, or the veterinarians might not be sufficient, and so farmers might not have the right information about how to properly use antibiotics to treat animal disease and not to make other use, such as, for example, for promoting growth. In this range of multiple challenges, we have, as a global community, become much better in this past 10 years, making a lot of progress with the different tools that have been developed, with the different governance mechanisms. So what do we want to see from the high-level meeting in 2024? It'll be important that if we're establishing global targets, we ensure that this allows countries as well to identify their own pathways to contribute to these targets, whether they are, for example, reduction of overall diseases, as a result from drug-resistant infections. Targets that should also relate to ensuring that we have access to diagnostic tools and to antibiotics for everyone when they need them. And we need targets for increasing financing. Right now, a target on financing is missing for the high-level declaration, and that will be important to include. And if we have an independent panel that helps bring scientific evidence, we want to also ensure that we have representation from developing countries, and so that our experts can also provide support in this important process to guide the right actions, and that together all we can contribute. Thank you very much.
Thank you, Rajeshwari. So we are right at the end of it. Maybe another 3-4 minutes with everyone's permission. Closing comments, 30 seconds for everyone. May I start with JP? What you have heard, JP, how do you think we take it forward?
No, I think I'm pleased to see that there are great ideas, and actually there's really lots of content from the LMICs. I think, yes, let's keep the momentum, but I would plead that let's go there just to provide constructive and moving forward. Let's first see what is in there, try to see what is good for LMICs, and really be supportive of what is there. I would say like the independent panel and the other good elements that are already in there. So let's not, again, create a block, or let's not block the process, because also it can also be another unintended consequence if we just say, LMICs, we need this. So we need also now have to be part of the world, and we need to support the process rather than maybe blocking the process as well. But of course, yes, read the political declaration with the lenses from the MICs and be constructive. Thanks.
Wonderful. Thank you, JP. Yevande, I know you just have to leave. If you have 30 seconds, any additional comments you wish to make?
So thanks. I think colleagues have really said it all. We are on the good track to positioning LMICs. We need to be strategic. We need to be clear. We have one last push, but I think September is not the end. Rather, September is the beginning, and we have to keep the momentum. So thank you so much for having me.
Thank you. Benedict?
Thank you. Nothing much to add. I think it's been a great forum. I've learned a lot from everyone, and I hope the momentum keeps on even after the UNGA meeting, and we can learn from each other and each other's countries. Yeah, thank you.
Lena?
I think the most important thing is how do we set up a monitoring mechanism of how the UNHLM is actually implemented in our countries, you know. So I think the need of the hour is, we know that August is going to bring a declaration. Member countries are going to go back, and we need to start supporting our health ministry to keep the momentum up on AMR. So maybe that's a concrete recommendation to all partners. Yeah.
Thank you, Lena. Dr. Chandi?
Thank you. Science, narrative, political commitment, financing. But to be honest, the LMICs, as we bring them in, it is very important not just to listen to them, but also to get them to move forward with contextual challenges and solutions. And if they have that buy-in and ownership, and they see successful models, then I think it is one step towards sustainability. Lastly, after the HLM and beyond, what will be crucial is to plan the matrix and the roadmap. And if we have to set it in place this year, so that we actually have a very definitive way to move forward for the coming years. Thank you.
Thank you very much, Dr. Chandi. Rajeshwari, you have any comment?
Very quickly, Amit, maybe we were discussing this today before the webinar. It's just that this entire discussion, the add-ons to the report and the findings of the report also in a way has a message for the LMICs as well. In a way, I'm sure you will build as you close it. That's what I wanted to highlight. It's something, there's a takeaway for LMIC countries as well, beyond the UNGA.
Okay, great. Thank you very much, everyone. From my side, nothing much to add other than the fact that clearly the time is now. And one important thing, yes, sharp messaging. It is not just about UNGA, but beyond. And it's the last push, let's say, for this HLM. But two key tasks are required in my view. One is the internal advocacy, the internal messaging that we have to do in our countries. And the second is the external advocacy. How do we first convince our people, our policymakers, for agreeing on, let's say, this thing, and this is important and this is not. And then also make sure that that thing is taken care of at the global level, at the level of negotiations. Very hard task. But I think we need to keep that in mind that this is one internal advocacy and there's this external advocacy or the global advocacy. So with that, I would like to conclude this. Thank you, everyone. Thank you all the people who participated in this webinar. Thank you all the panelists. So grateful to all of you for your time. Very insightful discussion. Many thanks to my colleagues also. And with that, I can just tell you that we will be at it. We will keep doing this. We will make sure that the last push is much stronger. So with that, thank you very much. Have a nice day, everyone. Bye-bye.
Thank you.